we all know this. If you will, you can broadly think of health care as either Medicare for the elderly, Medicaid for the poor, or you can think of private insurance market. So we have three distinct markets. What is really driving this debate right now is Medicare and Medicaid, and to an extent, but kind of lagging behind, is the private insurance market. Medicare, the Medicare Trust Fund, depending on who you talk to, will be bankrupt in 7 to 10 years. Now, of course, the trust fund is only for a certain part of Medicare. The other part is paid for out of the general fund, if you will. So Medicare indebtedness is one huge issue for our country. And when folks say, listen, I've paid into Medicare my whole life, why is the Medicare going bankrupt? For all of us who are baby boomers, we are the problem. When they first came up with Medicare, I wish people like you had been in the room, but they said, well, listen, every family has 4 kids. We presume that from henceforth, every family will have 4 kids. There always will be 4 kids paying for their parents, and we're going to have a population curve that looks like this. That was around 1964. In 1964 is when the birth control pill became increasingly used. And I think about what seemed as a detail then, now is rewriting history. Because as families became smaller, and by the way, even in Catholic Louisiana, most of us have more brothers and sisters than we do children. Even in Catholic Louisiana, families became smaller. And instead of a population curve that looks like this, we have one that looks kind of like this. For those of you old enough to remember, I say it looks like Twiggy's figure, you know, no curves. It just comes straight down. And therein lies the problem. Because instead of having lots of people paying for a few at the top, you have relatively few paying for lots at the top. 10,000 baby boomers enter Medicare every day. Wow. If we need to know why Medicare is going bankrupt, it is because actuaries were not employed at the outset of the program. What else? Medicaid. Medicaid, which is the combined program which both the federal government and the state government pays into, is bankrupting states across the nation. Whereas when Medicaid started, if this is a state budget, Medicaid would have been that portion. Now, in most states, it is the largest portion. And for the first time in most states, there is more Medicaid spending than there is upon education. Now, you think about it. As we fight over whether to crowd out money for roads, how we pay for prisons, how we're going to pay for higher education and secondary education, that debate is being driven by the giant sucking sound called Medicaid, because it is consuming ever larger portions of the state budget. Now, I'm not being partisan here. I'm just telling you what if you go to healthaffairs.org, or if you go to the GAO, or if you go anyplace else, these are the statistics you read. Lastly, the private health insurance market, which really is what most people are concerned about. Most voters are concerned about their insurance. And so if you will, a lot attention has been paid upon the private insurance market. So what are people particularly concerned about? Folks are concerned about the cost of their health insurance. Makes sense. They're saying, wait, why every year does my premium increase? And you come back and you say something about actuarial this and actuarial that, and they don't care. They just wanted their premiums controlled. So when President Obama ran, when candidate Obama ran, candidate Obama said that his health care plan would not involve an individual mandate and would lower the typical family's health insurance premium by 10%, roughly $1,200, $1,500 for a family of 4. And that was candidate Obama's. And that was very appealing because middle-class people were concerned about the cost of their health insurance. Now, let's go into the next part. What are the goals of health insurance reform? 3 major goals we all know, but just to set the stage. Control cost, to provide access to quality health care. Cost, access, quality. Those are the things that are the goals of every health insurance plan. When the president started off, he made access the principal goal. Idea being, in his mind, that if you increase access, and he would say this, that you would lower costs for providing access to quality preventive services. And he based this upon the Massachusetts model. which again emphasized access but less controlling of cost. Well, Massachusetts has some of the highest cost in the nation. I think for the small group market, Massachusetts either has the highest or the second highest premiums in the nation. Now, this is a state that started off being about 40 to 60% ERISA, so they had a good population of self-insured companies, and they only had 10% uninsured. I happen to also know that in federal contributions for Medicaid programs, Medicaid gets almost more per Massachusettsian than any other state. They get far more than Louisiana does on a per Medicaid enrollee. So even in a state where there's a heck of a lot of resources, we can see that cost has continued to explode. Now, how would you control cost? There's a McKinsey Quarterly report that, again, McKinsey Quarterly, you can look it up, and they said the 3 imperatives for controlling healthcare cost. Those 3 imperatives are to decrease administrative overhead, to control the cost of the burden of chronic disease, and to institute price transparency. All of these are intuitive. We know that the more administrative overhead sucks up, the less there is to take care of patients. We know that unless a woman who has a health savings account can walk into her OBGYN and know how much it's going to cost to deliver that baby on the front end, then she is at risk of bankrupting her HSA on the back end. By the way, there's an OBGYN congressman from Georgia whose daughter had an HSA, and that's exactly what happened. She didn't know how much it cost to deliver her baby. She goes in, she totally empties her HSA at the end of it, and she ends up on the hook. And so here is a OBGYN congressman who should have known, been able to tell his daughter how much her pregnancy was going to cost, and he didn't have a clue. Now, when we speak of price transparency as being a meaningful thing to lower cost, if that woman had been able to say, listen, you're $5,000, you're $2,500, I'm going to go with the $2,500 provided my outcomes are just the same as the $5,000, you introduce competition and you lower cost. So clearly price transparency is part of it. Now let's critique, if you will, the Affordable Care Act. If cost, access, and quality are our goals, and if the imperatives for controlling cost are price transparency, administrative overhead, and controlling the burden of chronic disease, it gives us an objective way to look at the Affordable Care Act. Let me pause and say one more thing. I'm a doctor, you're in the insurance industry, but we are first Americans. We are first Americans. And so as we're speaking about cost, I should have stepped back and said, wait, there is one overarching cost consideration. The President's Bipartisan Commission on the Debt says that the main driver of our national indebtedness is healthcare entitlements. And that Admiral Mullins, the recently retired chairman of the Joint Chief of Staffs, says that the greatest threat to our national security is not China or Al-Qaeda or Iran. It is our national indebtedness. If you will, it is the responsibility of we as Americans to address this issue of indebtedness. I will be more particular. For those of you and us in this room who know so much about healthcare, who know so much about controlling cost, far more than your neighbor who may be an engineer at Exxon or your friend who may be a teacher, it is up for us to come up with those solutions. If the greatest existential threat to our country is the indebtedness driven by healthcare entitlements, this is more than an academic discussion on a Tuesday morning. It is something of incredible long-term historical significance to the society we owe so much to. Now, if that sounds like hyperbole, listen to Admiral Mullins, listen to the President's Bipartisan Debt Commission. Now, let's come back to the body of which I speak of. Let's look at the President's Affordable Care Act, ACA, if you will, as to how it is able to meet McKinsey's criteria for controlling healthcare costs. Again, those are decreasing administrative overhead, price transparency, and controlling the burden of chronic disease. First, it is going to be an administrative nightmare. The CBO, I think it's a CBO, said that there are innumerable boards, bureaucracies, and commissions associated with the Affordable Care Act. I think, you have so many alphabet soups up there, I forget which one. One of them estimated is roughly 150. So it's 150 plus. So, one, I think, arguably, if there's innumerable boards, bureaucracies, and commissions, and as somebody told me, he saw it yesterday that the president just put $500 million in the IRS to hire more IRS agents to go make sure that people had, small businesses were complying with the law. That is not decreasing administrative overhead. Secondly, the president, one thing that Peter Orszag, who again has written in healthaffairs.org, you can go on the website, one thing that he touts as saving cost is the Independent Payment Advisory Board, the IPAB. And this is 15, 3 of them will be physicians, none of them can be practicing, they'll be economists and other healthcare providers and somebody from the insurance industry. And these 15 people will decide what to pay for and how to pay for it. And I'm thinking, man, the Soviet Union, I thought, proved that centrally planned economies do not work. But here we have 15 people in Washington, D.C. are going to come down into the exam room in Crowley, Louisiana and say, this test is not indicated. Now, that's only for Medicare, but as we know, Medicare is the straw that stirs the drink. And if Medicare is unable to control cost, it is going to pay below market rates, which means that cost will be shifted to the private insurance policies, and that hydraulic pressure will drive up premiums. So frankly, I think that their approach is the approach of arrogant Washingtonians who assume that they can come up with supercomputers with programs complicated enough to know every interaction that takes place in our medical lives. As a guy who on most Mondays and Tuesdays is seeing patients at Earl K. Long Hospital treating the uninsured, I find that silly. There is no way they're going to know what that interaction is. But that said, what about price transparency? There is little in the law regarding price transparencies. And in fact, health savings accounts, one thing that has been shown to decrease cost are totally prejudiced against by the MLR. Their MRL regulations, unless they are in some way softened, will be a dagger in the heart of health savings accounts, and yet health savings accounts are the one thing that have been shown to decrease cost. In fact, whenever they come to testify, I always ask, how are you going to apply MLR to HSAs? Well, we haven't thought about it. I'm thinking, well, your deadline is coming up pretty soon. If you haven't thought about it, you better hustle. Okay, we'll get to you. But they don't, because they think that HSAs are a rich man's tax dodge, not recognizing that to the middle-class families access to affordable quality health care. Now, the Affordable Care Act, though, is being implemented, and if President Obama is reelected, most likely it will be the law of the land. That said, there is a political legal environment with which it operates. It continues to be unpopular with the majority of Americans. You know this, in the President's State of the Union speech, he only spent 44 words on the Affordable Care Act. Now, his signature domestic piece of legislation, he dismissed with 44 words. That was seen as significant in Washington. He did not wish to draw attention to it. Why? Well, if quality, access, and cost are the issues, and most Americans were concerned about cost, since the bill has been enacted, the typical family of four's health care costs have gone up 5 to 10%. They've actually increased because of the law. That's kind of not where the president said that we were going to be. There's also a very unpopular individual mandate, which candidate Obama vociferously opposed. And so again, Americans understanding that's a reach into their personal life that they don't care for. But if he's reelected, most likely it'll be the law of the land, unless the Supreme Court decides otherwise. I had the incredible privilege of being, I'm not an attorney, but I was able to go on Tuesday morning when they heard arguments about the individual mandate. And I never use this word, but I'll use it now. It was truly august. I can see why attorneys treat the Supreme Court with reverence. But it was as an American, it was a privilege to be there. It made me proud. As someone said, we're not going to do what they do in Iran and drag you out back and shoot you. We will work out our differences in the Supreme Court of the United States, and whatever differences we have, we will go out and continue to be Americans. I will just tell you, we got a great country here, which is why, despite our problems, I'm still so optimistic. That said, I think the crux of it came down to Justice Kennedy asking the attorney, the Solicitor General, who was advocating for the Affordable Care Act, if we're going to allow Congress to do something which they've never done before, compelling people on a federal level to buy something which they otherwise would choose not to, what are the limits of the application of that? Is there a limit? Can you name a limit? And if we're going to allow Congress to do this, there must be a higher bar of justification. The Solicitor General truly had no answer to that. On the other side, the attorney that wrapped up finished by saying, in the future, if this law passes, if Congress finds a statistical association with anything which they deem to be greater good, this law, this precedent will give Congress the ability to intervene on that statistical association with that which is the greater good. Now, in my mind, this was a query about freedom and the logical conclusion of what happens if this precedent is upheld. But we don't know what the Supreme Court will decide. But I will say, as an American, however they decide, I am proud of us as an American people. But that finishes it. So we know in this room that if that individual mandate is thrown out, the insurance companies will come back and say to the Democratic administration, we can't do guaranteed issue. We cannot do community rating. We can look at states like New Jersey and Washington State that attempted to do so without an individual mandate, or New York, and we can see that this will kill the private insurance market. Now, there's some that feel like that is the goal. That really, Barney Frank, for example, was asked why he's voting for it because he always wanted a single-payer plan, and he said, hey, listen, I think it's going to lead there. Now, you got to give Barney marks for honesty. But he feels like the process, particularly if the individual mandate is eliminated, will lead to single payer. So that logically brings, in my last couple minutes, what would be Republican alternatives? And that's a fair question. I was in Lake Charles last night, great conversation with a group of people. Well, what would y'all propose? Okay. Well, I'm going to focus, again, if we think of it being Medicare, Medicaid, and private insurance, I would say that Ron Wyden, the liberal Democrat from Oregon, and Ron Wyden and Paul Ryan, the conservative Republican from Wisconsin, have put forward a credible plan, which was first proposed by John Breaux when a young whiz kid named Bobby Jindal was working with them under Bill Clinton, for a premium support plan. And under premium support, a senior citizen, if you're 55 and above, nothing would change, but if you're 54 and below, you as a senior citizen, that'd be me, would be given, just like Medicare Part D, the option to choose from plans that would come and offer to me. Humana here, Blue Cross Blue Shield there, Coventry here. I would go and I would say, okay, what's the best deal for me? Oh, look, here, Humana is the best deal for me this enrollment period. And if it is a bells and whistle policy, I will pay more out of pocket. If it is a policy which is more frugal, I may take home a rebate. There's a rebate in here. If I'm poor, the government still continues to pay for everything. If I'm Warren Buffett, I finally get my wish and I get to pay more than everybody else. Medicare Part D is incredibly popular. About 80 to 85% of seniors like Medicare Part D. It is based upon this. Wyden-Ryan plan saves Medicare. It saves it as it is for those who are on it and will be within the next 10 years. It preserves it for those of us who are less than 55 and will be on it. Otherwise, the program goes bankrupt. You may not like the Wyden-Ryan plan, but I just ask folks to come up with an alternative if they don't care for this bipartisan plan, which has its roots in John Breaux. In terms of Medicaid, I have my own ideas, but it's actually ideas that, again, began under the Clinton program. Mine is based on a per capita cap. Each of you, if you insure a small business. Go to the small business, you say, how many employees do you have? What are their demographics? Okay, you give me X amount of dollars per employee, and I'll provide you Y amount of insurance. There's quality indicators, and you're going to make sure I do a good job, but I'm at risk. Basically, the federal government would go to the states and would say, how many people do you have below a certain income level? Are they in a nursing home in which their cost is here? Are they blind and disabled, in which their cost is there? Or are they a pregnant woman or a child in which their cost is here? And you tell us how many are within each stovepipe, and we will reimburse you on a per capita cap for that. That's the simple thing of it. But you know, by the way, everything I just said, you're thinking, of course. When I tell people in Washington that Medicaid covers long-term care and children, and that the price differential between long-term care and children is dramatic, exponential, they're like, really? Oh, I didn't know that. And I say, if you block grant and you give Vermont the same amount as Utah, Utah's got a lot of young people, and Vermont is the oldest state in the nation. So if you just block grant, Utah's going to make out like a bandit, and the old people in Vermont are going to be moving to Utah. Everything that we take for granted, knowing, I've learned from you guys, by the way. It's not that I grew up with it. I learned it from you about the need to have an actuarial soundness. That needs to be applied to Medicaid, and then the federal government needs to address that. And lastly, the private insurance market. The private insurance market will be what I call more patient-centered. We do have models of what works. Health savings accounts clearly work. 20 to 30% less expensive than traditional insurance policies. People that have them access preventive services as frequently as those do with private insurance policies. I tell you, they could work better. We now have an HSA. I'm so glad we have an HSA, because when my wife says, how does this form work? It helps me understand that if we're going to make HSAs more used, we must make them more user-friendly. But on the other hand, I can't help but remember a small businesswoman from the Denham Springs area. We had a round table with women who ran their own businesses, and she came and she goes, oh, I have an HSA. And I quickly learned after the first visit to the ER that my daughter with a runny nose could wait until the next day. Okay? So patients become trained. Mamas begin to understand, and I say mamas because women make most healthcare decisions. Mama begin to understand how to do things that are wise for both their pocketbook as well as the health of their family, so they can really work. So, but I have more to say on that, but again, that's something that I wish to work on. Now, I will finish up by saying this, and then hopefully get a couple questions. I'm a U.S. representative. I am so privileged to be that. Will Rogers said that your elected representative is nothing but the hired help. And I actually think that's the appropriate attitude. In our democracy, I am to represent. I am to be the hired help. Now, you don't kick me around like a slave, but on the other hand, I am here to say that the greatest among us shall be our servants. And I always tell my staff, we want to be the greatest office there is. At first, they think this, but I acquaint them with that, I mean that. That said, I cannot represent unless you tell me what to represent. Unless I know what's on your mind, I cannot go up to Washington, D.C. and say, listen, this is what I learned at, what was that commissioner's name again? So, we have a few minutes left. I'm going to ask you to fulfill your part of the democratic bargain, which is to tell me your thoughts, have your questions so that I can represent. I always say this, I mean it sincerely. If I can channel the wisdom of the people in Louisiana onto the floor of the House of Representatives, I will represent my folks better, but more importantly, perhaps, I will do service to my community, my state, and my country. And that reflects upon us both. So that said, do we have 5 minutes for Don?